guys, it's Krisie here from Ethos and Summit. Today we're going to be taking care of this lovely patient. We're going to be doing a few different things. First, we're starting out with radio frequency microneedling, and we're going to follow that with a procedure called PRP and PRFM, where we're actually going to inject some of this patient's own plasma underneath her skin to get some growth and tissue stimulation, ultimately help with some of the under eye hollowing, some bagginess, as well as fine line wrinkles. And we're going to follow that afterwards with traditional microneedling, with also the PRP that we got from Nikki's blood. And we're going to microneedle that into her face with a traditional microneedling device, not with the radio frequency. Prior to this procedure, we cleaned and prepped the skin. Nikki also had a topical numbing paste. I've also given her a little bit of local anesthetic too when we inject the PRP. We also drew Nikki's blood just before this. We spun it down in the machine over there called a centrifuge. And then for the patient's comfort as well as the protection of the skin, we have a little bit of cold air. So happy for you guys to join me. And Nikki. Alright, so I'm gonna feel a little pressure. So here this is radio frequency, the microneedling. Our device here is secret. So in the lower portions of the face, I'm going a little tiny bit deeper to get a little bit more of that collagen stimulation deep within the tissue to help stimulate collagen and elastin and to essentially tighten the jawline. So she should be feeling a little bit, maybe a little heat. A little bit of discomfort, but overall with the topical numbing it should be okay. How are you feeling again?
I don't feel anything.
Okay, awesome. So in general we want to be mindful of different layers that we're using the microneedling device. In general, we want to stay a little bit deeper in areas where we have a little bit more tissue and room that we can potentially go deeper within the tissue to potentially, one, dissolve a little bit of fat underneath the neck. With Nikki specifically, she has a history of melasma, so we want to be mindful not to be too superficial with the radio frequency microneedling. So the heat associated with the radio frequency, if we're more superficial in the skin where the melanocytes tend to hang out, we can run into our problem and make her melasma a little bit worse, which we don't want to do. Our goal here is to obviously get her some improvement of the melasma. So that specifically, when we're going a little bit more superficial, I'm going to use the traditional the traditional microneedling device and not with the radio frequency, which essentially applies heat to the skin with all those microneedles. So what's great about microneedling, it causes a little bit of trauma to the skin, and when we do that, it ultimately stimulates collagen and elastin to form. So this procedure is awesome, but it takes time for your body to do that. So typically what we recommend is one treatment, typically every 4 to 6 weeks for a series of 3. Once we've done the series of 3, we typically will recommend doing one treatment annually to maintain those results. So her results will stay, what she gets after those 3 treatments, but once we kind of turn 30 or so, we lose collagen and elastin every year. So to kind of combat that, the once a year treatment is often a great option for most. Are you okay here?
I don't feel anything. Is the air
Super.
going on?
Yep, you're good. All good. So in general, people, like the microneedling device because, it helps with saggy skin, it helps with that crepey skin. It will help, a lot of people are concerned about the nasolabial fold. So when we kind of work in these areas to tighten the tissue, we can essentially soften those areas where they tend to fold and give some shadowing that's unsightly for us. So without numbing, I think this procedure is a little bit uncomfortable, so we always do recommend a topical numbing paste we give our patients in advance, typically applying it for about a half hour prior to treatment, plus the cold air often makes pretty good combination for the treatment to be as comfortable as humanly possible. So you can see her skin's getting a little bit red. In general, the skin will be red for typically about 24 hours. Overall, the majority of what we're doing to the skin is deeper within the dermis, so that's why the downtime is actually very, very favorable to most, where you're not having 3 to 5 days to a week of red, inflamed skin, dry skin. It's a pretty well tolerated procedure, especially afterwards. Typically, I do recommend not putting anything on the skin that could be occlusive, like an ointment or Vaseline, within the first 24 hours. There's a whole bunch of micro channels to the skin that we want to use to our advantage, and you'll see that after when we're doing the superficial microneedling with the PRP, where we want to take advantage of that and really kind of get those growth factors to the tissues that have the channels. Okay?
Yeah, I don't feel anything.
Awesome. So in general, after you do a treatment, when you come back for your second, you might start seeing the results from the first, but I always tell people it's kind of like watching paint dry. It takes a while for your body to stimulate those fibroblasts to make the collagen and elastin. So essentially, maybe when you're coming at that 4 to 6 week period of time, you might start noticing, hey, my skin's feeling a little bit tighter, a little bit more bouncy. Immediately after, in the next few days to follow, a lot of people will notice more superficial changes to the skin, a little bit of a glow, maybe the pores look a little bit smaller, but in general, it does take a little bit of time for those results to start to show. You're okay here? Yeah. So in general, most people can do microneedling. Major contraindications for people would be if they have a cardiac pacemaker or a deep brain stimulator. You don't want to, have anything that could potentially interfere with the radio wave energy of the device with, an implantable device such as as a pacemaker or deep brain stimulator. But otherwise, most people can tolerate this. Regarding skin types, it is safe in all skin types, but we do need to be more mindful of darker skin types. We want to use something like an insulated needle compared to a non-insulated needle. So somebody with a lighter skin type has a little bit more wiggle room with that. And then also patients, for example, even like with Nikki, she can certainly do radio frequency microneedling, but we do want to be mindful, with melasma, we don't want to exacerbate it with the heat of the device, so that's why we do stick a little bit deeper in the skin where, again, we're not going to be really disrupting those melanocytes. Just a little bit here. Okay. So what we did was we covered the lower portion of the face. We went a little bit deeper in general. We want to, again, get that stimulation of the collagen to ultimately tighten. We're going to see an overall improvement of the jawline in the sense of the skin is going to be a little bit more tight. Some of the fine lines in the neck will also start to soften. And now we're going to go to the PRP and PRFM. Again, we've already kind of prepped the skin by cleaning it. We've also drawn her blood and spun it in the centrifuge. just gonna feel a little pressure here. So what I'm doing, I previously numbed Nikki. I added a little bit of lidocaine, which is a local anesthetic, to where the pilot hole is for my cannula. I numbed it with lidocaine, and now I'm injecting something called PRFM. What this is platelets that we get that are rich in growth factors from Nikki's own blood. Now, what's great about it is underneath the eyes, when patients can be a little bit hollow, sometimes have a little bit of darkness underneath the eye and some shadowing. Some people often will report like a purplish hue underneath the eye. Basically, the PRP will help with that by ultimately, with her own tissue and growth factors, stimulate her own body to essentially heal itself. You're okay?
Yeah, I don't feel
Not
nothing.
too bad. So the difference with PRP and PRFM, where PRFM almost makes it into like a jelly-like substance, more so like a traditional hyaluronic acid-based filler, although we're not injecting a filler under Nikki's eye. Essentially, the PRFM will make a more of a jelly-like consistency, so we get a little bit of that volume underneath the eye to help with that hollowing. Okay, I'm gonna go on to the other side. Sorry. Okay, you're okay? Yeah. Okay. So here again, we're doing the PRFM. I just have a little bit of time because it can get a little bit clotted, so we do want to work quickly just with the PRFM, which contains that fibrin-like matrix for underneath the eye that, again, makes a little bit more of a jelly-like consistency opposed to more of a watery consistency, like just the traditional the plasma, platelet-rich plasma. So recommended treatment plan would be typically one treatment every 4 to 6 weeks approximately for a series of 3. And once we get to that desired goal, whether it be correction of the pigmentation versus volume, to keep up with those results, typically we do a treatment every 6 to 9 months thereafter. That's a major difference than traditional filler, where again you don't have to inject that often. Sorry, little pinch here.
Still don't feel it.
Good, awesome. Good.
I feel the pressure of your fingers,
Little
but
pressure.
I don't feel anything like.
Not too painful.
No, it's so painful.
Okay, awesome.
Feels like I'm getting a face massage.
I like it. We'll go with it. Same thing here. So it's very normal after a procedure such as PRP, because we are putting, and PRFM, we are putting an amount of volume underneath the eye, which again, it doesn't have a lot of space to hold. People will feel a little bit puffy. Sometimes if they're looking downwards, they might even feel like, oh, I can see underneath here where it looks a little puffy. That can last for, a few hours. And then also when your body starts responding to its own growth factors, it can actually get a little bit of swelling. But that's actually a very good endpoint, meaning that we're gonna see some awesome results. We'll pinch over here. You're okay?
Yeah, still don't feel it.
Good, awesome. So restrictions, just things that you really can't do afterwards. I usually tell people, no excessive exercise for, the first 24 hours. You want to take it easy. No super hot showers. Want to keep the skin a little bit more calm, you can certainly apply some ice for, 20 minutes on, 20 minutes off to help a little bit with that swelling.
Should I do like the massages like we do with sculpture?
No, actually, another thing is you don't have any homework, so sometimes with some of the biostimulators that we can inject, we'll recommend people massage the area for a bit of time for a few days. Certainly you can massage the area gently just to kind of help mobilize some of that swelling and fluid, but there's nothing that you necessarily have to do. I wouldn't put any makeup on today. For sure, 24 hours you want to keep the skin nice and clean and dry. But other than that, no major restrictions. Keep yourself hydrated. Something that's important to note before doing a PRP or PRFM treatment, you want to make sure you're well hydrated, because we have to draw your blood, so one, it will help us get a good vein where we can get your blood, but then you also can get more blood volume when you are well hydrated, which ultimately gets us more plasma that we can inject into, those soft tissues. Let's look here. Okay. Yeah. So the under eyes typically can be a very tricky area to treat, because with traditional fillers, sometimes people can get a little bit puffy, feel a little bit swollen. Sometimes, we can overfill an area, and it's more challenging to correct with a traditional filler compared to, being your own bioidentical self. You're not going to really have any major issues there. We do want to be mindful, about our vasculature and injecting into the correct tissue plane and area. Perfect. So we injected the PRP and the PRFM, again, platelet-rich plasma and platelet-rich fibrin matrix. So that's all done. And now, for the last little bit, we're going to actually do microneedling to the more superficial layers of Nikki's face. One, that will help with the fine lines and wrinkles. It will also help with pigment, collagen stimulation, but because we don't have the radio frequency component, we don't have to worry about heating up the skin too much. I'm also going to be, sorry.
I didn't know what it was. It felt so good.
All good.
Felt like a tickle.
Yeah. I'm also going to be microneedling her own plasma to, again, help with that healing process afterwards, so that recovery will become a little bit quicker. But again, also it will help, stimulate her own collagen to help with those fine lines and wrinkles. So again, this is traditional microneedling without radio frequency. So you're going to hear a little bit of a buzzing sound. Okay. It shouldn't be too bad, right?
No.
Okay. So it's important that we keep the skin lubricated, which we're kind of using her own plasma for that. Not too painful, right?
No, not at all.
Okay. So it sounds a little bit loud, but overall, not super painful. She again has that topical numbing on, but she probably doesn't feel the heat as she was feeling when we were using the radio frequency device. Doing okay?
Yeah, it's very comfortable.
Yeah. Try it. not too painful, right?
Not at all.
Good.
That's still completely numb, so I don't feel that at all.
So typically where people will have some of the most amount of discomfort will be over bony areas. You know, the forehead can have a little bit of discomfort, just again, not too much to protect it regarding fat and muscle, very thin layer. So if it gets a little spicy here, you let me know.
No, still numb.
Okay. So unlike the radial frequency microneedling, you might notice that sometimes the skin might look a little bit more bloody with this type of microneedling. The heat can actually act as a cauterization when we're using the radial frequency, but we don't have heat here, so essentially we can get a little bit more of that pinpoint bleeding. Using things like your own plasma are really great, you know, because again, you don't have to, you know, run the risk of, you know, allergies, inflammatory reactions, or responses to the skin. So some people can certainly opt for that treatment if they, you know, have any, you know, concerns there. And often people, you know, like the idea of their own body doing its work. So it's not that one is better than the other. It really boils down to, you know, what your comfort level is and, you know, what your goals are, and obviously having an in-depth consult with your healthcare provider can certainly guide you in the right direction. You okay?
Yeah, still don't feel it.
Good. You know, some other things to consider, you know, there's no way of knowing this, but, you know, you're only as good as your own growth factors, so there's not like a test that we can do to say, oh, you're going to have great growth factors, you know. I would say if you're not noticing a huge improvement after 3, I would consider maybe it's not the treatment of choice for you, but over the years I've been doing this, I've had a lot of people very happy with the results from PRP. There's other things that you can do with PRP. A lot of people will often inject into the scalp to help facilitate hair growth. Again, we can microneedle it here, just very superficially onto the skin. Again, it's going to help with the fine lines. It will help with the microneedling on pigmentation. That again won't be exacerbated in people that have some skin conditions that can be exacerbated by heat in some layers, and some lasers. So this is an optimal treatment for patients, you know, with melasma. But overall, anybody who's just looking to age gracefully and as youthfully as possible, I think this is a great option. You okay?
Yeah, still very comfortable.
Good. Okay, a little bit more here.
Sounds like you're shaving my
Yeah.
face.
Yeah, with the electric razor. I promise I'm not. Okay. Alright, so just to sum things up, I'm going to do another little bit left on her, but I'm just going to go through what we did today just to, you know, reiterate and recap. We started out with radio frequency microneedling. Again, we wanted to address things to ultimately help the jawline, help with some saggingness that we see to the skin. So ultimately, we'll get that collagen stimulation with the radio frequency. We treated the lower portion of her face a little bit deeper with the radio frequency microneedling. We follow that by a procedure called PRP and PRFM, where we previously drew her blood, spun it in the centrifuge, took out those platelet-rich growth factors that we can get from our blood. We like to call that liquid gold. We then mobilized it into something called PRFM, where it's more of a gelatinous type substance that will give a little bit of that volume. We'll also continue delaying the release of those growth factors, so we'll continue to see results over the next few weeks to come. We injected that underneath her eyes as well as into the cheek space, and then the piriform space. Again, that's to ultimately get a little bit of that collagen moving along, as well as to help with some of the discoloration underneath the eyes where we can see some darkening. And then we follow that with traditional microneedling throughout the whole portion of the face. Again, we wanted to be mindful with Nikki in this particular case. She does have melasma, so we don't want to heat up melasma and make things a little bit more angry. So we did not use heat with traditional microneedling. It's just the actual physical trauma of the microneedling device, and we actually pushed in those growth factors from the platelet-rich plasma. We're gonna let her skin settle down. We're gonna apply a nice cooling gel, and we'll be looking forward to seeing her in 4 to 6 weeks. Essentially 3 treatments, 4 to 6 weeks apart from one another for a series of 3 with the radio frequency microneedling, and then with the PRP and PRFM. After the initial 3, you're gonna wanna keep up with it once every 6 to 9 months. Nice seeing you guys here, and look forward to seeing you here. Take care.